The next presentation, which I was supposed to give, was on ultrasound, which Dr. Bloom has already covered. So the next 10 minutes, actually what I thought we'd do is make a little bit of a panel discussion before Dr. Pittman's talk, and discuss how do we, and maybe a continuation of our, Dr. Pittman will do yours on the right time. We were just going to do a quick panel discussion. Okay, you can have a seat right. I know they put it up, so they'll make them. You can have a seat for about a few minutes. So the questions that come up practically. So we have very successful vein practices here. We also have an international perspective on the podium. We have Jorge from Puerto Rico. We have Ernesto from Colombia. We've got Dr. Kikuchi here from Brazil. And how do we make our practices profitable while being ethical and legal? So I wanted to bring out a couple of questions. So the first thing is, at least I've done business for a long time and practiced medicine for a long time, and revenue minus expense equals cost. Profit. So first question is, how do you decrease costs in your practices while making sure you're ethical and legal and giving best quality to the patient? Any comments? I'd also love the, yes, Jorge, go ahead.
A couple of years back, we assessed all of our vendors, and we decided to stick with one product instead of having 3 machines there. And then we renegotiated the catheter price and did new contracts with the machines and everything. And that brought the case, for example, it used to cost me about $750 in materials and overhead per ablation case. And now it costs me about $580.
Excellent. Okay.
So one of the things that I will recommend is that to make sure that you understand what is it that you use, and make sure that you focus on one product and not have everybody.
Yeah.
Because hospitals do it all the time. They push one company. So why not do it in your office?
So just to follow up on that comment, so we're doing RF ablation forever. And I know one of the speakers this morning brought up Venclose, which is a new RF device. Earlier, this can do 10 centimeters and 2.5, and it's definitely cheaper than what we already had existing. Works beautifully, so we evaluated what we had. And again, we dropped our price significantly. But then we also looked at, we wanted the best outcome for the patient, of course, so we looked at that. But then we looked at what was unnecessary in just about everything we did in the room. I don't need an ultrasound tech in the room. I do it myself. I've trained my PAs, they do it. The ultrasound tech can actually be generating revenue elsewhere at the same time. Then I don't have all these extra assistants. We don't do it in an OR. Our tray is very simple, and if you do a lot of it, we do several thousand cases, it all adds up. So if you have 1,000 cases and you lose $100 per case, it's $100,000 right there. If you do 502, so $100,000 is a lot of money. So that was definitely one factor. And then also, I think one of the reasons this point came up was enough people came up to me and asked me, they'd get, marketing is very strong influence, and some of the people get marketed to with the newer devices, et cetera, and they are not aware that, yes, they get a little more reimbursement, but the price of the product they're using is also much higher, and actually their profit will be much lower. And for example, when you do sclerotherapy, just simple sclero, you get $160. And you may do an RF ablation where you get $1,500 from Medicare, $1,100 from Medicare, and you spend $900 or more on your devices and costs. You made less than the sclerotherapy. So we're running small businesses. Yeah, it's just that it happens to be healthcare, and we got it. That was definitely one factor. Any other international perspective or local perspectives on how you look at this? Rob, did you have a comment? Ernesto?
Okay. In our country, in my clinic, we do 2 things. The first is doing big efforts in marketing. And why? Because when we have a better marketing design or products, in this case is the products to clean the legs or the things that offers our company or base center, we have more particular patients. In this case, we when we have more particular patients or more private patients, we don't care about the cost. This is the first thing. The second thing is in doing investments in quality systems, like normal standards organization, like ISO 9001, are international standards for quality for all the organizations. When you're doing this kind of implementation in your companies or your main centers, you can reduce the cost of every participate in all the products into your clinic. And that quality standards help very and works very well in the new companies and the new organizations.
One quick question is, how many of you have purchased your generator box or laser box? Or anybody does that? Some of you have purchased. And then do you find that it was cheaper or better to do per product, or some of them lease it? Anybody on the panel?
Well, just make one comment. The dermatology practice that I contract with, we now have 34 offices and probably about 60 within 8 months. It's been purchased by a large group, and so we all sat down and decided what we were going to do, what was the most cost-effective, and pretty soon we'll have probably 25 vein centers in these practices. And what we decided, we looked at all the costs, and it's actually comes down to what you do, what you use, and myself, I use a laser with a disposable fiber, not disposable, reusable fiber. I do a lot of a cosmetic, and actually I realize about a 25% more profit than the other doctors that use RF.
You know, I'm just going to chime in a little bit with something that isn't. If we keep trying to save money as that total reimbursement price starts coming down, there's only so much you can squeeze out of a good contract, out of a good price, out of just lowering overhead. And something that is overlooked by a lot of practices is that the rep will come by and throw these things like, oh yeah, you're going to keep $1,000 out of that, $2,000 Blue Cross or $2,300, and that is true. But that's after you get to about 50 cases a month, because you're not going to break even with your investment, your employees, and so forth. So the point here being that your total volume, your flow, is what generates it, not just how much you make per case or how much you spend. And a way to stay on top of it is to go and have macros and systems where your flow of your patients isn't 6 patients a day, where it can be 25 and 30 and provide even better care than if you did see 6 patients a day. Without compromising the quality, your efficiency is what drives your profit. And that's why I said all these departments of having your authorization person, because all you got to do is do 1 case with a radiofrequency and not get reimbursed or get into that kind of stuff, and there goes your profit. So focus on your documentation to make it easier, quicker, your flow of patients to be better, and go after the low-lying fruit. There's a lot of patients out there that are more than happy to pay you cash for the procedures that aren't covered by their HMO or whatnot. So expand the base is my point there.
All right. Any questions from the audience related to this, in the business of running this? Yes, please.
You did mention the reimbursement coverage for puncturectomy, and last year at this meeting you had a debate between whether puncturectomy was still indicated if it had stone sclero replacement. So I don't see that on the agenda this year. So
Personally, I don't do any phlebectomy anymore. There's some people who do. I've done this for a very long time. No matter how well you do it, you still have a little skin tag. That's number one. Number two, from a business point of view, phlebectomy has a 90-day global period, and which means on that leg, if you do a phlebectomy and then you do another procedure, you're not getting paid for that in the next 90 days. And at least in my experience, once I've started using foam, whether it's Varithena, whether it's the hand compounded foam where you just do it yourself, but you have to be careful, phenomenal results, along with good compression. I mean, there's a patient who's going to come tomorrow, we're going to do his ultrasound, that Dr. Thorpe had open. He spoke last year and the year before that. He had an occluded IVC, occluded deep system. Dr. Thorpe opened all this. He has these massive vein, superficial veins, and with the combination of just foam and one where we did vent-close ablation of the straight segment GSV combined with foam, fantastic results. Not had to do a phlebectomy at all. So I've moved away from phlebectomy. Anybody on the panel do phlebectomies? You do? Okay. Rob does some. I know Ron's a fan of microphlebectomy where you combine it with sclera. So, these are all tools in your toolbox. You use what works for you. We haven't taken out our hooks in a couple of years now, maybe more. So, any other comments or questions related to that? Yes, we just have one more question.
I want to say one more thing. I'm accord with Dr. Coronado, and it's about when the patient have a perception of quality. In that perception of quality, if that have that sensation, they can or they want to pay until 30% more than your competence and to the other doctor. And it is a feedback, and when the patient pay more for your activity, they feel that is paying because your quality is better. These are techniques that are using very much in marketing in different areas. I say that because I'm studying like a chief marketing officer in my country, and there are different techniques that can be help in our general practice in medicine.
Well, one last comment, and then we'll move.
So I want to give some feedback on what Dr. Coronado said with regards of marketing. When I started my practice, I wanted to have the patient coming into what I call, in my mind, the vascular spa, because these people are very sick. So the first thing is that your office needs to look good. People, when they come to a place that doesn't look good, they feel like the doctors are not going to work well. It has to be like a complete experience. So the secretaries need to treat the patient well, the nurse needs to treat the patient well. We have a flow where we have the nurse come in, do a part, then 2 minutes later comes a resident, do another part. Then when I come in, everything is ready. So I discuss the case with the nurse, and then I greet everybody the same way, very respectful. So by the time they are done with the experience in my office, they feel well. And that's one of the things that you cannot top that with marketing, but marketing is very important. So make sure that in your office, the patient experience is key. So when they get out, they say, man, that doctor is so good. They had no idea you're working their mind up, They just come out thinking it was just a good experience. And to be honest with you, my marketing target is the patient and their families. I target people between 25 and 50 years because those are the daughters of the patient or the patient themselves. Okay, I don't want kids, so. And so make sure that you target the proper audience, because in reality, if you live in a place where, like the way I am, where everything is a capitation, doctors, they don't want to send them off to anybody. So what happens is that the patient goes to the doctor and says, you need to send me to this doctor because he's the one who treats this condition. So I educate people directly, and when they come in, they come either because they saw it on the website, they saw it on TV, they know exactly what's going on, and forget about, sometimes the referring physicians are important, but more important is the population that you're treating, and make sure that the patients are aware that you're there for them.